How does tinnitus masking compare to other tinnitus treatments? Have you ever wondered how tinnitus masking stacks up against other treatments for tinnitus? Tinnitus is a condition where individuals hear ringing or other sounds without an external source. Tinnitus masking is one way to manage this condition, and it uses external sounds to cover up the internal noise. This can be done with devices like hearing aids that have sound generators or standalone machines that produce white noise or nature sounds. The idea is to make the tinnitus less noticeable by providing a more pleasant sound. When we look at tinnitus masking compared to other treatments, we can see some key differences. First, there are various forms of sound therapy. Tinnitus masking is one type, but there is also tinnitus retraining therapy, or TRT. TRT combines sound therapy with counseling to help the brain get used to tinnitus over time. While masking gives immediate relief by covering the sounds, TRT aims for long-term adjustment and reduced sensitivity to the noise. Another option is hearing aids. For those with hearing loss, hearing aids can amplify outside sounds, which may help mask tinnitus and improve overall hearing. Unlike masking devices that focus solely on tinnitus, hearing aids address both hearing loss and tinnitus. Cognitive behavioral therapy, or CBT, is another approach. This therapy helps manage the emotional and psychological effects of tinnitus. While masking does not change the tinnitus sound, CBT helps patients change how they react to it, which can enhance their quality of life. Currently, there are no medications specifically approved for tinnitus. Some drugs may be used off-label to manage related symptoms like anxiety. Tinnitus masking, being a non-drug approach, has minimal side effects, while medications can carry risks and vary in effectiveness. There are also emerging treatments like neuromodulation and repetitive transcranial magnetic stimulation, but these are still being studied and are not standard care yet. Tinnitus masking is widely accessible and established compared to these experimental options. One of the main benefits of tinnitus masking is that it provides immediate relief without invasive procedures. It can be tailored to fit individual needs and is often found in hearing aids, offering dual benefits. However, it does not cure tinnitus or address its underlying causes. Its effectiveness can vary, and some people may find the masking sounds intrusive or not helpful. Regular use is often necessary to maintain relief. In summary, tinnitus masking is a practical method to manage tinnitus symptoms by providing sounds that cover the internal noise. It offers quick relief but does not tackle the root causes or emotional aspects of tinnitus. Other treatments like TRT and CBT focus on long-term adjustment and coping strategies, while hearing aids can enhance hearing and indirectly lessen tinnitus perception. Overall, the best management of tinnitus often includes a mix of approaches tailored to each person's unique situation. It is always wise to consult healthcare professionals specializing in hearing loss and tinnitus care for personalized advice.